Hi, before we start, I'd just like to say I'm in a different place at the moment. I'm visiting my brother who is rather ill. So if the video quality and the sound quality are not quite up to scratch, that's the reason. Okay, and now let's get into the video. Consultant doctors have voted to strike in pursuit of higher pay and a shorter working week. But are the public willing to tolerate it? They earn an average of £152,000 a year, putting them in the top 2% of earners in the UK, and want ministers to agree a multi-year pay deal to address what they say is a 25% fall in the value of their salaries since 2008 to 9. One can understand the grievance at a perceived loss of value, but with the NHS facing a money squeeze over the controversial decision to pay Donald Trump's United States more for drugs, is it appropriate for those very well-paid consultants to demand more? On the other hand, the very high workload faced by consultants is a matter of public record, and this, together with the current level of pay, is an obstacle to recruitment. It occurs to me that if the NHS is trying to recruit more consultants with a consequent expected increase in expenditure, then perhaps a compromise can be reached. Will they take the currently planned pay rise with a reduction in hours, or a slightly higher rise with a cut in working time? What is the Department of Health and Social Care willing to accept in order to make recruitment easier? Or does the government not care about providing enough doctors to do a proper job? That would mean people would suffer and possibly die unnecessarily in breach of what the government says is its first duty: to protect UK citizens. The evidence strongly supports the claim that consultants are under intense pressure. Chronic staff shortages, rising demand, and administrative burdens are well documented across the NHS. But after years of NHS disruption from industrial action, and immediately after resident doctors settled their dispute, consultants face a much harder task persuading the public that another round of strikes is necessary. The average patient waiting months for treatment is unlikely to be sympathetic to doctors earning six-figure salaries seeking both higher pay and shorter standard hours. Even if one accepts that consultants are overworked, is industrial action justified when the dispute is over restoring relative pay and improving contractual conditions rather than preventing an immediate deterioration in patient safety? Clearly, there is an issue, because we know that consultants really are overworked. But these are intelligent ladies and gentlemen. Is it too much to ask that the Department of Health and Social Care can work with them to find a solution that helps not only both sides in the dispute, but patients as well?